How is healthcare reform affecting the Garden State, especially small businesses and the people who work there? Joining us now is Dr. Jaime Torres, the Regional Director of the U.S. Department of Health and Human Services. We welcome you to the program. This apparently was a big day for you because you were out there talking about the healthcare exchange and major changes that will come as a result of it.
Absolutely, Mike. As you know, every state of the nation will have a health insurance marketplace beginning the beginning of 2014, but in our state, basically, we're going to be running the marketplace. So we had our first stakeholder meetings from stakeholders from all over the state in New Brunswick, and we just came back from that. So we had people very much energized to make sure that we can put the information out, and we can enroll almost to 1 million people who are uninsured.
1 million people?
On our
Who are these people? These are middle-class people?
These are folks who are small families, middle-class people who work in small businesses, who their businesses are not able to afford coverage. So they're people who are working hard, but they cannot afford to buy health coverage.
Salary range is what?
It can, you know, there's a whole range of salaries, but basically people who in the small market, it's so expensive to buy insurance by yourself that before, yes, you could buy it, but it was astronomical. So now it's important to know that beginning next year, we will be able to offer you competitive health insurance, but also offer subsidies to help you pay for the insurance, because it only works if everybody's covered.
This will be for people to buy insurance through private insurance companies?
That's correct. Every marketplace will have private insurance competing for your services. And for example, small businesses will benefit because in the past they have paid at least 18% more for the same coverage than a large business. So now we're going to pull them together and lower the cost and offer quality insurance, and small businesses right now can also get tax credit to pay for that.
The Affordable Care Act gives the small businesses, as of I think next year, a 50% tax credit?
Correct. Yeah. Small businesses, and we're talking about in New Jersey over 160,000 small businesses who have 25 employees or less. Those businesses who pay for some of at least 50% of health coverage, we're giving them back 35% back, and beginning in 2014 it's going to go back to 50% back.
And this is any kind of small business under 25 employees. Doesn't matter if you run a candy store or a doctor's office?
That is correct. And also non-for-profits. In the non-for-profits, the range is a little bit different. It's 25% now and 35% later.
How can we hear reports, though, from some who say small businesses are cutting back on employees because they don't want these costs that will be triggered if they have people, say, work enough hours that they would have to qualify to give them?
You know, the truth of the matter is that 96% of all businesses in the United States are small businesses. Those are who have 50 employees or less. And none of them will be required to buy health insurance. So we're talking about only 4%. And of those 4%, the majority of them already offer health insurance. So there's a lot of misinformation and there's a lot of confusion. And I think as implementation goes on, people will see the benefit for small businesses and also the families.
Your region includes New York as well as New Jersey and also
Puerto Rico and the Virgin Islands, where I grew up.
Absolutely. So you have a wide-ranging portfolio.
Indeed.
In our metropolitan area, how different is the situation in New Jersey than, say, New York?
Well, in terms of the healthcare implementation and the exchanges, it will be seamless. It doesn't matter if you're in New York or New Jersey, you will not see a difference. The experience will be the same. The tax credits will be the same. So that is the beauty of this healthcare reform. It will be similar across the nation. And all that information that I've been providing can be accessed through healthcare.gov. And that's one of the places that small businesses and individuals can get that information.
Governor Christie's decision to expand and adopt Affordable Health Care Act, expansion of Medicaid in this state, what does it mean to you?
Fantastic. This is for the first time in our state. Childless adults, men and women who do not have children that in the past were not able to get Medicaid, now will be able to get Medicaid. We're talking about an individual making $15,000 or a family of 4 making $30,000. So for the first time, we're expecting at least over 300,000 individuals to be eligible for the Medicaid expansion in New Jersey. Fantastic idea, and I congratulate the governor on that.
Dr. Torres, we have to leave it there. Thank you for coming in, sir.
Thank you so much.